But Anita, I'm going to come to you to begin with for our first question, one that was submitted ahead of time. Can you talk to us about the different types of mental health problems, and have the rates of all of them gone up, or is it some in particular that have gone up? So Anita, perhaps you'd like to make some comments about that first question.
Yeah, thank you. I think Alex has made the job very easy for me, because I think one of the issues is distinguishing between mental health and mental health problems and diagnoses. So mental health is relevant to everyone, as Alex has highlighted. Mental health problems are when there is, usually people are talking about anxiety, depression, where there are some symptoms, but you might be able to manage with counselling, some self-management, help from people around you. And then you've got the sort of clinical diagnoses, or that some people might call mental illnesses, some of which actually require to go and see specialist services, which, as we've already heard before, isn't always easy to get to. The rates, and there are many different types of diagnoses. So you've got the ones that start early, which are called neurodevelopmental diagnoses, like ADHD, autism. And people with those conditions, and Alex, you mentioned about ADHD, are at higher risk also of developing mental health problems, which tend to come later, more in sort of late childhood, adolescence. And these include conditions such as depression and anxiety, sort of more severe types, obsessive compulsive disorder, post-traumatic stress disorder, eating disorders. I mean, this is just some of them. So they're quite a variety, and the interventions we use aren't exactly the same. There are some common things across mental health, but once you've got a condition, the interventions aren't the same. So some of these have increased in young people, because we're focusing on young people, particularly the 16 to 24-year-old age group. Rates of depression, I mean, we have had lots of surveys done in the UK and in Wales. We're very lucky. We have systems of monitoring health of all our young people in schools. Rates of anxiety and depression have gone up, self-harm, and also which people working in services will recognise, eating disorders. And that increase has been particularly prominent in females in the older adolescent group. Now, you might think that not everything has gone up, but what our research in our group has been showing is that even conditions such as ADHD, where the population levels don't seem to be going up, everyone will recognise referrals have gone up. Of course, that's a good thing if people are recognising these issues, but the studies suggest that the impact of these conditions, even if the rates haven't gone up in the population, seem to be worse today than a generation before. And quite a lot of our research is finding out, well, how is this happening? There are some clues. One possibility, there's associations with people from poorer households. Academic strain is another issue, because we know children with special educational needs are particularly vulnerable, those with chronic physical health problems. So it's an area of research, but yeah, the rates have gone up of quite a lot of things, and the impact of even conditions that haven't gone up.
That's really helpful, Anita. Thank you very much. A second question, and this one's for Fran, again, just while people are thinking. Fran, and I think, again, Alex helps us with the beginning of the answer to this question, but the question is, how do we reduce anxiety and depression and prevent those problems from developing or escalating?
Yes, so you kind of set the scene nicely. A lot of the research that we do at Cardiff is really about trying to understand and inform early intervention and prevention. There's different types of approaches, certainly for depression, for trying to prevent kind of more serious depression, depressive disorders in young people. The evidence suggests that what works best and what's more effective is if we target psychological interventions at young people who have some risk factors and are more likely to benefit from this. In terms of, I suppose, a slightly different type of approach, there are public health type approaches where that's really thinking about trying to improve well-being and health behaviours and sort of lower levels of anxiety more generally in the population. And for there, a different type of approach might be more helpful, where it's really about the systems that young people live in, and trying to adapt the complex systems that people live in. And so schools is a key area, and really good quality international research has shown that if we can make schools, I suppose, systems that work better and support young people where they like school and feel engaged in it more, that has knock-on beneficial effects on anxiety, symptoms, and health behaviours. And we've got something called the School Health Research Network that social scientists in Cardiff lead, and they've been really working on trying to implement that in schools across Wales. Another fantastic thing that we've got in Wales is data infrastructure, where we can collect anonymously and securely collate information from NHS patients. And that essentially provides an opportunity for tracking long-term beneficial effects of preventive interventions. So, for instance, we've got a study that's ongoing currently, a preventive intervention where we're trying to prevent depression from escalating in young people. And there we ask, it's called SWELL, by the way, and there we ask people for their permission to link their research data to SAIL, and so that allows us to track long-term beneficial effects very, very effectively and efficiently.
That's really helpful to understand. And of course, it's one of the great benefits of being in Wales, isn't it? Is having that population data that allows us to do some things that might be harder in a larger context, in a larger place. Okay, time for an audience question. I've got some in my back pocket. Cullen, we'll come to you. But who would like to start from the audience?
Just a question, Dr. Alex, you talked about the stigma around mental health and things. Do you think there needs to be a different way in the way we talk about it in terms of everything being called disorder? It can be quite a negative kind of way of thinking about it. And I just wonder if the way that it's labelled and talked about can have that kind of stigma or help, well, kind of make that stigma worse.
So your head's connected to your body. It's connected to your body. So I think it'd be beautiful to see health much more connected. But in terms of the mental aspect, I think it is really important because, I mean, mental health is a spectrum, really, right? So everyone has it. If you're alive, you've got a heartbeat, you've got physical health. If you're cognizant, you've got mental health. So you've got perfect mental health at this end, which very few people have. You've got severe mental illness at the other end. And somewhere along the middle, you might have mental health problems developing. All the way down towards illness. But I think in terms of, myself, I'm very conscious. I try and talk about mental fitness a lot because mental fitness, people like the idea of physical fitness, going to the gym or exercising or resting or whatever it might be to build physical fitness. Why can't we do that for our minds as well? So things like that can be helpful within schools. And if you look at emotional literacy with young children, a lot of those words are about using positive words, but also recognizing that things like feeling sad is also normal. We shouldn't demonize. Before I did this talk, I felt a bit nervous. That's pretty normal. I think we were saying beforehand, if you're kind of not nervous, and I'm not saying you don't care, but I think nerves are a good thing before an exam, helps you focus. So I think not demonizing some of the words are very important, but also trying to use words that, I think looking after your mental health is really good. If you want to live a good life and be successful in whatever field, working on your mental health is a really great way to improve. I actually had a good example, and this was an amazing day for me. The other day I managed to have Oscar Piastri from the Formula One team, the McLaren team, on my podcast Stompcast, and I was asking him about mental health in sport, and he was like, well, actually, if you look at a Formula One car, they pay hundreds of thousands of pounds for like little upgrades on the car, maybe an adjustment to the wing or using new material to gain like 0.01 of a second. Like tiny fractions. But you said, like, actually, if you don't work on the mental health of the driver and optimize that side of it, it's kind of irrelevant the hundreds of thousands of pounds you spend in the car. And I think that was really useful to hear someone within the motorsport say, actually, yeah, of course I work on my mental health. Why wouldn't I? So I don't know if that answered the question, but I think being positive about it where appropriate is important.
It's really helpful, isn't it? One of the best advice that anyone ever gave me was, if there's no adrenaline, it's no good. And it's something I hang on to this day, the slight little heart palpitation before you do something. Okay, who's our next question? We've got one there. So Alex, we won't ask you to be the runner, but So there we go. Well done. You've got your steps in for today.
Yeah. This might be slightly outside the remit of this talk, so forgive me, but talking about neurodevelopmental disorders, which obviously have implications for mental health, do you think that they're a little bit too siloed, that there should be, I wouldn't say merged, but kind of a more holistic approach? Because in childhood, some can be picked up and not others. And as I know from my own personal experience, that can have huge implications for mental health, both in terms of like regret from childhood and, you know, difficulties knowing, what I'm going to do going forwards and that sort of thing. So do you think there should be, and, the same applies to mental health, do you think there should be a more holistic approach to mental health and neurodivergence?
Anita, yes, I think, Anita, that might be one for you, is it? Do you want to make a few comments about that?
Yeah, I think it's a really important point and a really tricky one to get right. In fact, our minister in Wales has now become mental health and neurodivergence, and some people were very much in favour of that, and other people really didn't like it. So I think it's really tricky, and I'm not sure what the answer is, but I think what we don't want is silos, and I think what we don't want is people with neurodivergence not being able to access mental health. And you and I have talked about it, people in child and adolescent mental health services, then not being able to get support if they then get picked up, say, having ADHD or being autistic. So those silos, and equally the silos with physical health as well. I mean, it's very convenient for services and management, and of course we operate in those sorts of systems, but what we really want is systems that work around a person, not for the systems, for the person. How you do that, I'm sure every government official would be love to hear from someone. But no, I agree, and in fact, I've actually been practicing for a very long time, since 1986, and we didn't used to silo then. We used to just see everything, but I think as the demand has gone up, things have got more siloed, and that's a shame. I agree with you, but yeah, I guess we need people like Alex to campaign that they don't get, people who are neurodivergent get mental health support, and vice versa.
But I was diagnosed ADHD a few years ago, and I think that's a real shame. I think that's really, I could have had a much different, I could talk all day about my experience at school, and it wasn't great largely. But I think also, I think a lot of my experience was put down to anxiety and other, say, mental illnesses, but actually that wasn't the cause of my experience or my symptoms. So sometimes not having things too separate also prevents you from going, oh, well, he's got anxiety, that explains everything, when it doesn't.
Conley, I'd like to bring you into the conversation now. Would you like to talk a little bit about the research that's going on here at Cardiff University about ADHD and how that fits in with the conversation we're having?
Yeah. Hello, everyone. And to build upon what everyone has talked about, we've talked about mental disorders. You've just asked the question about neurodiversity and other mental health conditions. And in recognition of those links, specifically that when there is neurodiversity or ADHD specifically, it tends to be associated with many more other mental health difficulties. For example, depression. And one of the lines of research currently in the department is looking at what the links between ADHD and depression are. When does it start? How does it progress during development? And what are the factors that influence it? And it's work that is ongoing at the moment. I'm looking forward to what the findings will be. Another line of research someone else is leading is looking at ADHD among girls, among women. And the question is, if we look at research, it tends to be that ADHD is more commonly reported, diagnosed among boys, among men. And it's not as if girls don't have it. So the question is, why is the diagnosis delayed among girls, or even why is it mixed? And there is a lot of research we are doing on that. Is it based on the types of questions we ask about ADHD? Is it based on the questionnaires we use to assess the symptoms and many other things like that? But those are just the tips of it. And we have a passion for not just doing research for the sake of it. We also try to make sure that what we do leads to something real in life. So one of the things we do with the research, with the findings from the research, is to then use that to create resources for young people with ADHD. We are hoping to get more money to do more of that, but we have expertise in the department for designing digital media. And then one of the things I find very unique about the department is beyond doing the research, we also try to make links with policymakers. So we have someone whose special role in the department is to form that bridge. So we do the research, we find interesting things, we find useful things, and then it makes that link with policy, tells them what we are doing, and then we hope that that leads to real life changes for people.
Fantastic. Exactly the kind of research that we're really trying to encourage here at Cardiff University, that partnered and porous approach where, you know, we're really trying to get our research out there to make a real difference in the world. Okay, back to the audience. We've got a question here.
So it goes without saying that since the pandemic, mental health has definitely come a lot more into the conversation. But one thing I might be interested to know is, how has the kind of post-pandemic mental health versus pre-pandemic, how has it changed your approach to research? Like, how has much changed in that respect?
That's a really good question. Fran, do you want to start us off on that one?
I'm going to have a little think about that for a minute. Yeah, I think you're completely right that it's come into the conversation more, and I think that's a positive thing. I guess. So we started a big research centre focusing on anxiety, trying to understand anxiety and depression. We launched during the pandemic. And actually, although we did a lot of work with young people with lived experience of anxiety and depression, one of the things that investment has really enabled is that we've got that's embedded in all that we do now. And so we really try to work with young people around all of our sort of research projects and bids. And I think that's been a positive change. And you know, in lots of ways, I think we have got a few people from our advisory board in the audience. I can't see. Oh, yeah. Okay. Here's Nathan at the back and Tammy. But, you know, they're brilliant ambassadors and sort of really passionate and want to use that experience to advocate for change, you know, and that I think is important. So that's one example.
Anita, is there anything you'd want to add?
I think the other interesting thing is that during the pandemic, we had to operate digitally. I mean, through using both clinically and in for our research. And of course, we were very relieved when we no longer had to, and we could actually see people in person. But it also did open up the possibility of engaging people who hadn't previously engaged in research before. So that, you know, it's not like that's always a good thing, as I said, that, you know, for the clinical side, we did not like it, but for some of the research, it worked really well in terms of accessibility, that, you know, if you weren't sitting in a university city and you couldn't get to youth advisory groups, or you couldn't participate in research. So I guess in some ways it changed in a more flexible way, so that there was pluses and minuses.
Yeah, no, that's really good, really helpful. We've got a question up the back there.
Several studies have shown that PhD students in particular, they report severe depression during their PhD studies, and I think that's around 74% of them. And having experience being a PhD student and also working with PhD students, what I noticed is that when students indicate that they are facing depression or anxiety, the first thing that they're offered is to take time off studies. And sitting together, we are hoping that universities would develop some kind of way of, rather than asking us to take time off from university, to actually support us within the university environment, because taking time off is not always as helpful because it can just make you feel more isolated. So my question to you is, what kind of strategies do you think universities should be looking at in order to support students within the university?
I'm going to ask you, Alex, because this is a really important cohort for us, and often this is a very individualizing and isolating process. So Alex, tips for us in terms of our PhD student.
Thank you. Thank you so much. Sorry, stealing it from you. Do you know, it's funny that you say that because there's a coffee shop where I live and there's a lovely gentleman there and we get chatting and I'm very nosy. I like to know what people are up to. And he's working there, but he's also studying a PhD in, I think he's learning something crazy about neutrons in physics, which I mean, I try and understand it, but it blows my mind. I need to get coffee with him more often, clearly. But what he did tell me is how hard it is to actually be a student. He was saying, like, honestly, if I did it again, would I? I don't know, because I'm working here. I've got another job. I'm doing the PhD. You know, he's in his late 30s, and there's all the other responsibilities. And I found that really fascinating. So thank you for kind of raising that point. And I guess it, you know, to try and broaden out slightly, I guess, it shows how important it is that we do, when we support students, think about what are the needs of that individual, that cohort. If you think about PhD students, what are the specific pressures or things they're going to experience? Do they have children at home with their family pressures? Are they juggling other jobs and so on? And you made a very important point that actually, if the pressure, for example, one of the core pressures is that study, saying taking time out might not be the most helpful thing because you still need to come back to it. And also you might be isolated. It's kind of like, to make a very slightly random but analogy that's in my mind, but you know, in football, I spoke to a footballer the other day who's had an injury for a long period of time and he's injured. So he had to, first of all, leave the team, then train on his own for a long period of time. And actually it wasn't the injury that's the worst part, it's being isolated. So I think it's thinking about supports that's targeted for PhD students. So to answer it really, I guess like what I do a lot with my work is that I go and find out what do the students want, what do young people want, and then we try and amplify that. So I guess to throw back the question, it's like, well, what do the PhD students want? What's the most effective form of support?
I suppose two thoughts really, just particularly about PhD students, and one is that it can be quite isolating, and so having connections and a peer group is massively important. And the other thing I think is it's around these flexible systems around a person, where sometimes our academic regulations are not flexible enough around the person. And so offering somebody an interruption of studies, which I think is what usually is what's offered, is perhaps less flexible than we might offer an employee, for instance, where we might offer them a bit more of a phased return.
Okay, that's really helpful. Look, I know there are lots more questions, but unfortunately, we have run out of time. So it falls to me to thank everyone who's been involved in tonight's event. Alex, absolutely terrific. So wonderful to see you in person. We absolutely understand why it is that you've got the important roles that you've got in this space, your passion and commitment. I think we're all incredibly grateful for. Our incredible Cardiff University academics, just a snippet of the work that they do this evening. But as part of that wider Neuroscience and Mental Health Innovation Institute, doing fantastic work that really aims to have an impact, to make a difference in the real world. So Diolch and Val, thank you so much for joining us all this evening, and we look forward to seeing you again soon.